The obesity cancer crisis is not hitting all groups equally, and for Latina and Black women, the burden is especially severe. These women are not only more likely to live with obesity, but also less likely to receive timely cancer screenings, particularly for breast, cervical, and endometrial cancers. The result is a deadly convergence of biological vulnerability and systemic neglect, one that is quietly shortening lives and deepening racial health disparities across the United States. The data are damning. Obesity rates are significantly higher among Latina and Black women than among white women. In many cases, more than half of adult women in these communities meet the clinical definition of obesity. That excess body fat is far from harmless. It drives up estrogen levels post-menopause, increases insulin resistance, promotes inflammation, and creates the perfect storm for hormone-sensitive cancers, especially breast and endometrial. After menopause, fat tissue becomes the primary site of estrogen production. Higher estrogen levels are strongly linked to increased risk of breast and uterine cancers. For Black and Latina women, who often experience higher rates of obesity in midlife and beyond, this translates into a sharp rise in cancer risk, at precisely the time when screening and early detection could make the most difference. Yet these women are systematically less likely to be screened on time, or even at all. Black women, in particular, are more likely to be diagnosed with aggressive subtypes of breast cancer, such as triple-negative breast cancer, which are harder to treat and have worse outcomes. Yet mammography rates remain lower, and when screening does occur, it's often delayed or inconsistent. For Latina women, Pap smears and HPV testing for cervical cancer are also underutilized, particularly among those with limited English proficiency, recent immigration status, or without health insurance. This isn't just a matter of individual behavior, it's a direct result of healthcare inequality. Minority women are more likely to be uninsured, to face language or cultural barriers in care, and to live in medically underserved areas with fewer clinics, fewer specialists, and fewer opportunities for preventive care. Even when they do seek care, they often face dismissiveness or bias from healthcare providers, leading to mistrust and disengagement from the system. At the same time, public health messaging often fails to resonate. Many campaigns targeting obesity or cancer prevention are not culturally tailored. They fail to consider different dietary traditions, family structures, health beliefs, or socioeconomic pressures. Instead, they present generic advice that doesn't connect to real life, and therefore doesn't work. Structural racism adds another layer of damage. Historical medical exploitation, economic marginalization, and underrepresentation in clinical trials mean that both prevention and treatment strategies are less effective for these populations. Medical advice based on data from white, middle-class populations doesn't always translate, and yet it's applied across the board, leaving Latina and Black women underserved at every level of care. The consequences are heartbreaking. Higher obesity rates lead to higher cancer risk. Lower screening rates mean later diagnoses. Systemic bias reduces treatment effectiveness. The result: worse outcomes, lower survival rates, and a cycle that repeats from one generation to the next. This is not just a health issue. It's a matter of justice. If we want to address the obesity-cancer connection meaningfully, we must start by confronting the racial and socioeconomic disparities that amplify its impact. That means investing in culturally competent care, expanding insurance coverage, funding local clinics in underserved areas, and redesigning public health campaigns to actually reach and reflect the women they claim to serve. Otherwise, Black and Latino women will continue to face a triple threat: higher biological risk, lower medical support, and a system that too often sees their suffering as inevitable. It isn't. But without urgent and focused action, it will continue, and the lives lost will not be random, but predictable and preventable.